So schizophrenia is one of the more serious of the major mental illnesses. It has the potential to be a very complex, chronic, and disabling neurological disorder. Acute care general hospitals have a major role to play in both the acute presentation of schizophrenia and the long-term prevention of some of the more significant deficits associated with the illness, along with our community mental health partners. Continuous uninterrupted medication treatment is one of the cornerstones for the treatment of schizophrenia. We know that non-adherence to medication leads to relapse. We know that anywhere from 40 to 90% of patients will not adhere to antipsychotic treatments. And we know that upwards of 80% of patients will relapse within 1 year of antipsychotic medication non-adherence. You will see on your screen a breakdown of healthcare program costs associated with schizophrenia in Canada, data taken from 2004. As you can see, more than 3/4 of direct costs associated with schizophrenia are due to hospitalization and residential care. So we have attempted to communicate with a range of hospitals, academic facilities, non-academic facilities across provinces within Canada to try and see if we can identify key factors within the hospital treatment that may impact or influence patient engagement and ultimately patient outcomes. So our goal was to have a better understanding of what are the key administrative functions, what are the key aspects of organizing an outpatient schizophrenia program that will help keep individuals well. You will find reported here in this article some of the preliminary insights that have been gleaned from these sessions with some of the hospitals across the country. At this point, I'm going to turn things over to Lorna Thompson, one of the nurses who work in our outpatient program, to further elaborate on some of these themes.
So one of the themes that we identified is continuity in treatment and transitions. The patients that we look after often are seen or identified on an inpatient basis, but throughout the time, the patients transition from inpatients to outpatients to the community treatment. The patients have this illness for a lifetime, so there's a variety of times where they go through these transition periods, and one of the themes that we identified is that we ensure that those patients are seen and followed through appropriately during these transition periods. They're high-risk times for the patients where we can lose them, they go back to their lives, they don't follow up with treatment, they don't engage in treatment, and it ends up with relapse. It is widely understood amongst mental health professionals that these patients are a huge risk for metabolic syndrome, diabetes, and cardiovascular disease. In fact, Dr. Kozaczynski mentioned that the lifespan of these patients is often much less than the average population. One of the themes that we've identified in our research is that the comorbidities for these patients need to be addressed, looking at risk factors and addressing their health concerns. These patients often do not have access to medical care in the sense that they have difficulty following up with their physicians, or sometimes physicians are not willing to see them because of the complexities of their care. Medication adherence is the additional theme that we identified during our research. It is one of the most challenging parts of treatment for patients from a healthcare perspective, as well as one of the most difficult areas for patients to address. They have a lot of difficulty accepting their illness and accepting treatment along with it. So that is a huge barrier to keep patients from relapse, and one of the areas we need to address. Some of the strategies that were identified during our research for medication adherence were simplified medication regimes, having a clinical pharmacist on the treatment team, and having assessment tools for medication adherence in which we engage the patients and discuss why or why not they are participating in their medication regime. One of the strategies that was identified was the implementation of long-acting injectables for patients with schizophrenia. The utilization of long-acting injectables tends to increase adherence and takes away a lot of the stress at home from families with regards to having the patients take their tablets. It is hoped with the preliminary ideas in this paper we will be able to provide policymakers and administrators some guidelines and some ideas on how to better provide health care for these patients suffering from schizophrenia.
This video, along with the journal article and the qualitative research meetings, has been supported by an unrestricted educational grant from Janssen.